To start this research study off, we are going to talk about the abstract. So this study was tested on the effect of resistance training on postpartum women. There were 60 participants in the study, but only 44 completers because 16 dropped out for different varying reasons. There were 18 weeks of resistance training or flexibility training. The main group was the resistance training group, and then they had an active comparison group of the flexibility training group. The different study outcomes of the training were muscular strength, adverse events, body composition, exercise, self-efficacy, depressive symptoms, and physical activity. And then the results were that the resistance training group pretty much succeeded in everything compared to the flexibility group. So they had greater strength gains, better self-efficacy, which is basically, self-efficacy is basically the person's belief in their ability to complete certain tasks. And then they also had improved physical activity and decreased depression. So just for the introduction, we'll talk about the physical activity benefits for postpartum women and the different physical activity recommendations. So to start off with the benefits, obviously if you don't do any physical activity, you're living a sedentary lifestyle, which basically means there's like a lack of physical activity, so it's easier to get diseases. So if you do physical activity, then your chances of having diseases goes down. And then for postpartum women, physical activity can reduce the postpartum weight that they gain. And it says in the research, it said that 20% of women retain 5 kilograms or about 11 pounds above their pre-pregnancy weight after childbirth. So if you do physical activity, you can reduce the chances of that happening. And then also physical activity can improve overall happiness and improve or regain strength. And it said that in the article, it also said how postpartum women lose strength after childbirth, so it is important to gain it back, so physical activity can help that. And then some physical activity recommendations. Resistance training is the main one, and it is unexplored in postpartum women, and there was only one prior recent study to this study that was done, so that just shows why this study is so important.
So in the methods portion of this particular study, they had to find some qualified recruits for this. So the recruitment process was that they were recruited from a local community in which 60 postpartum women were involved with the study. There were at least 30 participants per group, estimate as 25 of them yielded a power of 0.75 for fat-free mass, in which all of them were healthy enough for PA, in which gained approval by their physician. One of the exercises that they were partaking was resistance training intervention, in which the participants provided a 4-month membership to a physical therapy clinic for the appropriate equipment process. Their 9 exercises included all muscle groups, in which 1 to 3 sets per exercise, 90 seconds of rest, 8 to 12 reps per set on at least 2 non-consecutive days. Some other exercises the exercises that were included with this resistance training intervention included leg extensions, seated leg curl, leg presses, bicep curls, shoulder press, chest press, and ab curl-ups. Why was this flexibility test chosen? It was a nationally standardized test, and it was found to be valid. So another part of the methods was the flexibility training, aside from the resistance training intervention. They had to perform this twice weekly, and which was based on the American College of Sports Medicine position. It was including stretching 4 stretch per major muscle groups, in which they had to hold for at least in between 10 to 30 seconds. Apart from the other intervention, the sessions were not supervised, so the participants had description on how to do each stretch, but they had to record their progress with the option to participate in a group once a week.
The next topic we're going to be talking about is testing procedures. So some of the tests that participants had to do were strength tests, flexibility, exercise, self-efficacy, depressive symptoms, and physical activity tests. And the participants were tested at baseline, 2 months, and 4 months. And each time the participants were tested, they had to go to a human performance lab, and they visited that lab twice during each testing period, each 1 week apart. And then at baseline, the participants had to do an informed consent. They had to do questionnaires, including health history questionnaires, demographic, exercise self-efficacy, and depressive symptoms questionnaires. They also had to do a warm-up, sit and reach test. They were instructed on the proper techniques of leg press, bench press, and curl tests, just so that it minimized any possible learning effects in the test. And then they're also provided an actigraph, which measured their physical activity, and you just wear it like a watch. And then at 2 and 4 months, when they came back to do more testing, the actigraphs were collected just to download the data for future analysis. And then their height, weight, and body comp were assessed. And for body comp, they used the DEXA, so the dual energy X-ray absorptiometry. And then also at 2 and 4 months was strength training. And just to follow off strength training for the strength assessments. So the participants were assessed on upper body, lower body, and trunk. So for upper body and lower body, it was bench press and leg press, and a 3 to 5 rep max was used instead of a 1 rep max. This is just to reduce any adverse events, reduce any injuries. And then the weight selected for the bench and leg press was just 50 to 70% of the subject's estimated capacity to lift 3 to 5 times. And then the max weight that they did lift 3 to 5 times, 3 to 5 rep max, was measured and used in the Brzezinski equation, which is basically the weight, which is the 3 to 5 rep max, divided by 1.0278 minus 0.0278 times the amount of reps, so 3 to 5. And then, the 3 to 5 rep max was used instead of 1 rep max. And then for the trunk test, it was just an abdominal curl up, so it was pretty much as many curl ups as the participant could do, or as many as they could do until they were off the set rhythm of 40 beats per minute.
In this experiment, the flexibility assessment was assessed in a 2-month and 4-month period using the standard sit and reach test. After a quick warm-up exercise, these women are to perform the sit and reach stretch 3 times. This flexibility test was chosen because it is a nationally standardized test and has been found to be justifiable. The inter-class correlation resulted in 0.96, and their confidence interval resulted in 0.94 to 0.97. Moving on to the adverse events, the participants were asked to immediately report to a member of the research staff if they experience any sort of joint pain or out of the ordinary muscular pain. As shown on the table, the reasons for attrition are injury, loss of interest, pregnancy, withdrew after randomization, lack of time, moved from area, and unknown. The groups recorded in this experiment are the resistance training and flexibility training group. In total, 3 women got injured, 1 had a loss of interest, 3 got pregnant, 2 withdrew after randomization, 2 found a lack of time, 2 moved from the area, and 3 had unknown reasons. During the body composition assessment, their body weight was recorded using a digital scale. The participants needed to be barefoot and wear a standardized swimsuit. The height was measured with a stadiometer and the body mass index was calculated by kilograms per meter square. The dual energy X-ray absorptiometry, also known as DXA, was used to measure fat mass, fat-free mass, body fat percentage, hip bone mineral density, and whole body bone mineral density. The DXA was also found to be reliable and valid. Exercise self-efficacy was measured by using a short questionnaire which had 5 separate items beginning with the stem, "I am confident I can participate in regular exercise when," followed by "when I am tired, when I am in a bad mood, when I feel I don't have the time, when I am on vacation, or when it is raining or snowing." The respondent choices included "does not apply to me." Using the scale of 1 to 11, 1 of being not at all confident and 11 being very confident.
The results of the study were dependent on the 44 participants that completed the study, consisting of 23 in the flexibility training group and 21 in the resistance training group. It was reported that the resistance training group completed around 93% of their prescribed workouts, whereas the flexibility training group completed around 80%. This study showed improvements in strength for both groups in terms of leg press, abdominal curl-ups, and bench press, but no significant difference in sit and reach. The resistance training group improved to a greater extent in these exercises than the flexibility training group. Additionally, body composition and anthropometric measures were generally improved in both groups, though there was no significant difference in body mass index, body weight, fat mass, fat-free mass, body fat percentage, whole body bone mineral density, or hip bone mineral density. In terms of self-efficacy, both groups saw a significant change. However, the resistance training group showed better exercise self-efficacy by the end of the experiment than the flexibility training group. Furthermore, resistance training group saw a significant decrease in their CESD scores within the 4 months of the experiment, unlike the flexibility training group, who saw no change. Overall, the resistance training group showed greater improvement in sedentary and light intensity activity time, though there were no observed improvements in vigorous intensity physical activity or moderate to vigorous physical activity time. This study proved resistance training in postpartum women to increase strength as well as obtain better exercise self-efficacy. While both the resistance training and flexibility group showed improvements in strength, the resistance training group was significantly stronger than the others by the end of the 4 months. Additionally, the resistance training group of this experiment showed a 7.1% improvement in their ability to exercise while tired and a 4.3% increase in their ability to exercise while in a bad mood. The flexibility training group, on the other hand, saw a 9.1% decrease in their ability to exercise tired and a 5.8% decrease in their ability to exercise in a bad mood. Even though the depression scores weren't found to be significant, there are still some notable findings that shouldn't be skipped over. In the resistance training group, 10 out of 10 of the participants classified as depressed at the beginning of the experiment were no longer considered depressed, and 7 out of 8 of the participants exhibiting depressive symptoms no longer had them by the end of the study. On the contrary, only 50% of the participants considered depressed in the beginning of the study were healed by the end in the flexibility training group, and 88% of them had resolved their depressive symptoms. In addition to this, sedentary time and light intensity physical activity time improved more in the resistance training group than that of the flexibility training group. The resistance training group saw a 22-minute decrease in sedentary time per day, as well as a 20-minute increase in light intensity activity time per day. The flexibility training group reduced their sedentary time by 9 minutes and increased their light intensity activity time by 8 minutes a day. This difference is likely due to increased strength and confidence in the resistance training group. In conclusion, this study found that twice-weekly resistance training may be beneficial for postpartum women, as proven experimentally through an increase in strength, general activity time, and exercise self-efficacy, and a decrease in depression scores. Thanks for watching.